Hi, I'm Dr. Stacy Ripke, and for today's 3-Minute Mondays, I'm here at the NYU Oral Cancer Center with Dr. Brian Schmidt, where there are faculty not only treating cancer patients, but also pioneering research to better understand this disease. I'm so eager to learn more about this really important work, so come along with us.
We started the NYU Oral Cancer Center in 2013. I don't know of another oral cancer center either within a dental school or in a medical school or biomedical institute. We are entirely focused on oral cancer. So this is our Translational Research Center. We have 10,000 square feet that's entirely dedicated to clinical research. We have 2 inpatient rooms. This is one of our inpatient rooms. Patients have come in. We've had sleep studies where we study their sleep patterns overnight. We've had transplant studies where they'll spend 12 to 18 hours with us. And we have 4 suites like this. I call them chemotherapy or drug delivery suites where patients can spend an entire day in one of these rooms. We have 8 dental operatories that are dedicated to clinical research, and patients can be screened, evaluated, treated, and studies in these operatories. We have 2 surgical suites where I see and examine patients with oral cancer. We do a number of our studies in these rooms and then follow our patients over time when they come back over years.
My research program at the NYU College of Dentistry focuses on lesion pathology and how it relates to oral cancer pain. And then our overarching goal is to then translate some of these discoveries from the lab back into the clinic where we can go on to help patients both with pain and if you're really lucky also with probably stopping or delaying their cancer.
Projects that we have been working on is to understand the molecular and cellular mechanisms of oral cancer pain. So particularly we are also very interested in repurposing cancer treatment therapies and how that might be helpful for also reducing cancer pain in patients.
I'm responsible for the largest component of the didactic curriculum in the area of training our dental students to understand the importance of early detection of oral cancer and these oral potentially malignant disorders. I think that our dental graduates have a stronger educational base. We have a very, big component in the curriculum that is dedicated to this.
So working with Dr. Schmidt and all the other researchers in the lab, I gained the ability to ask a question. The question is really to kind of how do we solve these problems and how do we bring them from the clinical side into the lab. And with that ability, you also gain the ability to answer the question using various molecular bio methodologies.
I am truly in awe of the remarkable work that is happening here at the NYU Oral Cancer Center here at the college and the impact that this is having on patient lives every day as well as across the broader field. That's it for today's 3-Minute Mondays, and I'll see you next week.